It's Facial Plastics Friday, Dr. Brace here, and it's our last episode on complex rhinoplasty. We've talked about revision rhinoplasty, rhinoplasty in the setting of a septal perforation, rhinoplasty for the really small nose that you're trying to make bigger, and then today I want to talk about the opposite. When you have somebody with a really large nose that they want to make smaller, and then the catch here is that they have thick skin. So if you think of the structure of the nose, I've drawn a nose here with a big bump here. This is the septal cartilage in here, and then the septal bone, and the skin is draped over the bone and the cartilage. If we were to go in and do what we call profileplasty and remove all of this cartilage and bone, you now have a whole bunch of dead space. You have all of this space here that your skin has to contract over and redrape. And when you add in thick skin or really oily skin, that's really not predictable, and often it doesn't contract as much as we hope to or as much as we want. And so this makes this rhinoplasty difficult because, well, the aesthetic goal of the person seeking the rhinoplasty might be a small little nose. It's not always possible. Ironically, sometimes in these noses we have to make them a little bit bigger in order to make them look smaller. What I mean by that is if you have really thick skin and you have a bump here and you want that to look smooth, you can actually put a graft up top and make the nose bigger, stretching that skin over that framework so that it ends up looking smaller or more refined. Often we can take down some of that bump. We can break the bones and push them together, and we can make the nose a little bit smaller, but it's always a difficult conversation with patients who have thick skin and a big nose who show me a goal image of a tiny nose, which really isn't possible. And so the complexity in this nose is really finding the balance with the patient on what is a realistic expectation for their nose when we do imaging, what will they be happy with, and then really trying to deliver that, which means not only some techniques in the operating room, but often post-surgical steroid injections to try to get the skin to contract, taping over the nose to help keep it pulled down, and then really hoping that skin contracts. Now, some of the problems that can happen if you make the nose too small and the skin's too thick, dead space doesn't close, is you can get something called the soft tissue polybeak. So instead of the swelling coming down as they're healing, you actually get this growth right at the end of the nose that gets bigger, and that's scar tissue. If this space right here doesn't stick down onto the cartilage, your body will fill it in. We call that a soft tissue polybeak. It sometimes responds to steroids, but sometimes we have to go back and do a revision and actually make the whole nose a little bit bigger because the skin wasn't responding the way we wanted. So that's the last topic in complex rhinoplasty, the thick skin, big nose, trying to make it smaller. You can usually make it look close to what the patient wants or the person wants, but maybe not in a way that they were expecting, because you might have to make it bigger in some parts and maybe a little bit smaller in others, but not exactly what they were hoping for. If you have any questions on rhinoplasty, send them our way, and everybody have a great weekend.